Hello and good evening from Amsterdam, from Mind Explorations, from a little tiny podcast for hypnotherapists, NLP practitioners, and those who are interested in learning about it. And today I have with me, or tonight, I have with me Dr. Becca. And she is an expert on sleep. And we're going to discuss sleep, something we all dream of, to give you the whole title. And we're going to discuss how hypnotherapists and NLP professionals and any therapists can use her knowledge and to improve their practice and to enhance whatever they're doing at the moment, because Becca knows a lot of tricks. And before we get into those tricks and the background of why Becca started to get into this. Why don't you just introduce yourself, Becca? Hi, welcome.
Hello everyone. Well, I'm Becca. I'm a hypnotherapist. I'm also a coach, and I'm a cognitive behavioral therapist for Insomnia practitioner. So I've been doing this for a few years now. I've been a hypnotherapist for 5 years, and as everyone does when they start off doing, hypnotherapy, you sort of dabble in lots of different areas and find out where you want to be, getting your experience. And then as you progress and you develop a niche, likely more often than not, your niche is where you feel that you have congruence and authority because you've had likely personal experience in that area. And so I developed my knowledge and my experience, my expertise in insomnia because that's what I suffered with for over 14 years.
hmm And you and I saw your talk at the Irish Hypnotherapy Conference in Dublin this year, and that's where you went into the background of how your
My
insomnia
story.
started, your story. If I don't know if you want to share that
Yeah,
or not. Yeah.
I can give you an overview of my story. So I was in a very unhappy marriage. So quite often with insomnia, it generally starts with some kind of emotional trauma. So there's usually a significant emotional event that sets off a pattern of not sleeping very well. And in most cases, after a couple of weeks, 2 to 3 weeks, or a short period of time. So, say for example, you've got a problem in the family, you've had stress at work, you've had something that's caused an emotional upset. In most cases, within a few weeks, that resolves itself and your sleep pattern goes back to normal. But if you've got something that goes on over a long period of time, you unknowingly, and I'll talk about this later on as well, but unknowingly you sort of develop behavioral patterns that fuel insomnia. And so then insomnia becomes chronic. So in my experience, I was in a very unhappy marriage for quite a long time. I was married for 20 years, and I can honestly say for about 14 of those, it wasn't very good at all. But anyway, I stuck at it for one reason or another. And I didn't even realize it was happening to me, to be honest. I think over a long period of time, stress, constant stress, living in the conditions where it was very stressful. There was lots of, roller coasters of emotions, as well as living, having a job, trying to run a job. I have a farm, so trying to run a farm, trying to run a family home. Um, I was on the road to burnout basically,
Mhm.
and over a period of, well, it got to like 2013, and that was sort of the worst year for me, really. There was a build up before that. In 2013, there was quite a number of significant emotional events over that year. For example, just my grandma she got dementia. So and I was really close to my grandparents, being the eldest grandchild. So there was lots of emotional trauma around that. One of my dogs was really ill with pyometra. She ended up
Oh.
in the vets and having a hysterectomy. But that it was just, again, problems with the marriage. Unfortunately, my sister-in-law passed away that
Mhm.
year as well. She had an accident and passed away. So there was lots of trauma in in a short space of time in that
Mm.
particular year, there was lots of things, but also over a longer period of time as well. So these, if you can imagine that, these things building up and building up, and if you know the analogy that hypnotherapists often use, well, I use it a lot with my clients, where you go through life with a rucksack on your back, and
Mm.
each one of these things is like a rock that goes in to that rucksack on your back, and eventually, you know, that rucksack weighs you down so much that it tips you over backwards. Well, that's what it did to me.
Mm.
And by 2019, my marriage had completely broken down. COVID hit. I was going through the most horrendous divorce, going through COVID, and I was in burnout. I absolutely hit rock bottom. I had, you know, I had suicidal thoughts. I didn't want to be here anymore. If it wasn't for my animals, I wouldn't be here now. They were the only reason that I woke up in the morning. They were the reason that I got out of bed in the morning. They kept me, they gave me function, they gave me a reason to still be here.
Mm.
On top of all that, I say burnout and insomnia are closely linked. And so and also sleep and mental health is very closely linked. So if you can imagine, you know, all these years of stress, of trauma, anxiety, burnout, not sleeping, and at its worst, my insomnia would mean that I wasn't sleeping at all. Like I would lie there all night with my eyes closed, wishing myself to sleep, but literally tossing and turning. And you said you've heard the phrase tired but wired. You know, you're exhausted, but your brain doesn't switch off. That was at its worst. Not every day was like that, but other days would be I would fall asleep, then I'd be awake at 1 o'clock, 3 o'clock, 5 o'clock.
Mm.
So, you know, your alarm goes off at 7 o'clock and you can't get up. And then you know, trying to work as well when you are absolutely physically exhausted. So sleep affects a massive area of your life. When you don't sleep, it affects your concentration, it affects your mood, it affects your ability to be productive in life, it affects your relationships with other people, your mental, you know, your mental health. There's a lot of
Mm.
research now out there that proves, you know, that demonstrates that there's big links between insomnia and depression,
Mm.
because when you don't sleep properly, the emotional regulation that goes on in the stage of your sleep in REM sleep, where the emotional regulation goes on, doesn't happen. If you're not getting those stages of those, you know, the correct stages of sleep, or enough stages of those sleep, then the biological functions that go on in those stages don't happen. So that's sort of my story, how I sort of ended up knowing so much about what it feels like to live with insomnia. And also going back those years as well, I wasn't in the therapy world. So I didn't know what I know now. I didn't know that there was another way of dealing with it. I went to the doctors, you know, I had a mental health nurse, you know, because of obviously the emotional state that I was in. But they also prescribed me with Zopicon at one point. I've had Zopicon,
Mm.
which made me feel like a zombie. That's like the prescription strength Z drugs, highly addictive. In fact, now they rarely prescribe prescription strength sleeping tablets
Mm.
because of the risk of addiction. They just made me feel dreadful. I didn't want to take them. I also had metazapine, which is an antidepressant, but also focuses heavily on your sleep. Again, made me feel like a zombie. I didn't like taking that. Hypnotherapy, that's when I discovered hypnotherapy as well. So I'd had counselling and stuff, but counselling didn't really work for me either. Now, hypnotherapy did to a certain extent, because hypnotherapy helped me release a lot of the stress, a lot of the tension, a lot of the anxiety that I've been carrying around over all those years.
Mm.
Um, I had a lot of release with hypnosis, a lot,
Mm.
but it still didn't cure the sleeping. So it helped me in loads of other ways, but it didn't fix my sleeping pattern. And
Mm.
that is when I discovered cognitive behavioral therapy for insomnia. And when
Mm.
I'd done that, that's when my sleeping pattern really, really did change.
Mm.
So that's why
So
now I incorporate that.
yeah, how long did you have insomnia for? How
About
many?
14 years,
How
thereabout.
many years?
14?
14 years.
Hmm.
Every night you're tossing and turning.
Hmm.
Wow, that's a long
Yeah,
time. That's a very
it is
long
a
time.
long time. Yeah, it is a long time. And you
And
know, like most people with insomnia, but you do sort of become experts in sleep, because a lot of my
yeah,
clients and people that I speak to, they go, "Oh, I've tried everything. I've tried everything to sleep."
yeah,
And generally people who struggle sleeping do try everything. So they try um, chamomile tea, they try lavender, they try hypnotherapy recordings, they try all the gadgets. I've got some gadgets here to
yeah,
to show you, but you know, they become very well experienced, you know, very well versed in saying, "Oh, I've tried everything, it doesn't work."
yeah.
But then they do my program, and you know, it's a hard, challenging program to reset, because you reset it when you do cognitive behavioral therapy for insomnia. You are resetting your biological rhythm. You
Yeah.
you're working again, you know, with your circadian rhythm. It's very sensitive. You use your circadian rhythm. You can disrupt it really easily, like when you get jet lag. You know, when you've travelled or when you've
Yeah.
done shift work. It's really easy to upset it and to
Yeah.
get out of a sleep pattern. It's quite difficult and challenging. It takes quite a long time for it to reset.
Hmm.
But
Can we
sorry.
go into the
Mm.
how this happens, this the physical side of insomnia? How do
Okay.
you first of all, how do you tell the difference between just normal bad sleeping and insomnia? What's the definition of that? Or
Okay.
is there any difference?
Yeah. Okay. So, like I said earlier, when you have so a normal night's sleep would be anywhere. I mean, we're all different, okay? And the NHS and the NICE guidelines suggest that we should have between 7 and 9 hours sleep,
Hmm.
you know, to function. Because sleep is a necessary biological function,
Yeah.
okay? And when we're in sleep, we have different stages of sleep. So, and different biological functions happen in each of those stages of sleep. So a sleep cycle will last around 90 minutes.
Hmm.
And within that sleep cycle, you've got when you know, when you get into bed, you know, you've got that first part of the sleep, like first 10-15 minutes when you feel yourself drift. And if anyone's ever experienced those hypnagogic jerks where you jump or you feel like you're slipping,
Hmm.
that's when your body's just starting to, they're really common. And they're called hypnagogic jerks. And
Hmm.
you get those in the very first part of your sleep cycle. Then you go into a second sleep cycle, second stage, like a non-REM sleep, stage 2. And again, that's a light sleep when you're just drifting and your body's shutting down, everything's calming down, everything's slowing down, your systems are all preparing to go into a deeper stage of sleep. Now,
Hmm.
in the early parts of the night, you get more deep sleep. So your deeper sleep, your non-REM stage 3 sleep happens earlier on. Most of it, the bigger chunks of it happen earlier on in the night.
Hmm.
So in that stage of sleep, this is why it's really important. And because in the deepest part of your sleep is where your body, your brain is flushing out all the toxins. It's
Hmm.
called a glymphatic wash. So during the day, our brain processes lots of information. You've got lots of brain activity. Your brain heats up with all the activity, and a byproduct of that is all these like proteins and you know amyloids and plaques and things that develop. And as a byproduct of all this activity, this protein
Hmm.
buildup. So in your deep stage sleep, your brain basically is like a washing machine. It floods out, it flushes out all the proteins that are built
Hmm.
up from that activity during the day. And also you get a release of growth hormone. So in your deeper sleep, your brain's flushing out, getting rid of all the buildup of toxins and things from the day, and also your body
Hmm.
releases other hormones, but in particular growth hormone. And so a lot of repair of your cells and things is done in that
Hmm.
deep sleep stage. And
Yeah.
then in your REM sleep cycle, that is when your body, that's when it's called REM. You know, you got your eye moves a lot, your eyes move a lot, sorry, and your body gets paralyzed. So your
Hmm.
muscles relax completely. Your body's paralyzed so that you don't act out your dreams, and your brain is processing emotions. Your brain is
Hmm.
processing emotions and it's processing memories, and it's deciding what it needs to keep and what it needs to get rid of.
Hmm.
So when you have, so just going back to, most of the deep sleep happens earlier on in the night, and most of the light sleep happens in the latter part of the night. So you get less deep sleep in the latter part of the night and greater amounts of lighter sleep, which is why we often get these early morning wake ups at like 3 a.m., 5 a.m., because you're in a lighter sleep anyway. You get a natural cortisol spike at that time in the morning, because that's what's kickstarting your body. A natural cortisol spike tells your organs, tells everything inside your body getting ready to wake up. And if you're stressed anyway, you've got things going on in your mind, and you've got high levels of cortisol running around in your system already, when your body gets that natural spike of cortisol, you're more likely to wake up. So going back to your question, when you are having this stressful experience, you're most likely then to, get these stages of sleep, get these sleep cycles of 90 minutes. You're supposed to have between 7 and 9. Most people, everyone's different. Some function better off 6, some 9. If you're having a period of stress in your life, then you might not get that. But like I said, when you have a stressful experience, in most cases it should resolve itself after 2 to 3 weeks, maybe. If it doesn't, then it creates a pattern of sleep, which then transgresses into an insomnia. So a bad night's sleep would be, you've just been tossing and turning, and you wake up, you're feeling a bit tired, and it's just like 1 or 2 nights sleep maybe that's disturbed, or a short period of time. So anything less than up to 3 months would be classed as like acute, and over 3 months would be chronic. But it's generally that sort of thing. So a short period of time of disturbed sleep isn't really an issue. It's when it transgresses and creates, develops post 3 months, that it would develop into insomnia. And that's really and insomnia, the DSM-5 classification of insomnia would be if you struggle with falling asleep, staying asleep, or waking up too early for at least 3 nights a week over a period of at least 3 months. And those sleepless nights are not attributed to any other reason. So, for example, a medical condition, or they're not a side effect of medication that you're taking, or there's not genetic, something genetic, some reason why you're not sleeping.
Which illnesses or chronic conditions would that be that cause insomnia?
Well, there's some side effects of I'm not quite sure which medications, but some medications do keep people awake at night. Medical conditions, I know people with autism don't often sleep very well.
Right.
People, like, say, for example, if you've got cancer, you might not sleep very well. If you've got something really, really medically wrong that keeps you in pain, then you might not sleep very well.
Yeah. So, of course, stress-related issues, because that would be the stress that's keeping you awake as well. So pain and stress.
Mental health issues. So people, schizophrenia, bipolar, those kind of things, maybe. Severe mental health conditions where people don't sleep properly. Dementia. That's
Depression, dementia, bipolar, etc. Thanks, Henry. Okay. So I wrote down, why do we have insomnia? Why that sounds like a stupid question, but is there a reason why the brain is keeping us awake like that?
Higher levels of cortisol. I think higher levels of and it's not just higher levels of cortisol, but also it's the behaviors that we develop that fuel insomnia. So without realizing what we're doing, so when, for example, you don't sleep very well, what might you do when you're in bed, or what might you do when you don't sleep very well?
Go on your phone, probably, nowadays.
Yeah, you might go on your phone. Yeah, you do. People think, oh, right, okay, I'm not sleeping, so I'll just scroll on my phone. I'll watch telly in bed. I might do some, emails for work.
3 in the morning,
People do. People get up and, people lie in bed and start getting the laptops out, and people generate behaviors thinking that they're helping, but they're actually not. And it's the behaviors that people develop that actually perpetuate the insomnia. So
Right.
what we do in cognitive behavioral therapy for insomnia is we look at these behaviors, we try and identify the behaviors that people are doing, because unknowingly, like just scrolling on your phone
Yeah.
is not helping you sleep.
Mm.
So a bed should be used just for, so we need to recreate, we need to reduce the stimuli that are in the bedroom and that, the behaviors that people are doing that are stimulus to keeping you awake. So we need to re-engage the brain and regenerate this connection, reconnect the brain with solely bed. Bed is for sleeping or
Mm-hmm.
sex. That is it.
Mm-hmm.
Nothing else. So we need to reconnect. So if you imagine, like, if you've been a non-sleeper for years, so here's me, right? And things that I used to do would definitely be watching telly in bed, watching movies, on my phone, Facebooking. I would read, but I wouldn't say reading is a negative thing when it comes to sleep. I think reading is
Mm-hmm.
something that tires your eyes out, and is helpful. But it is about not doing the day activities
Mm-hmm.
in bed. So not eating in bed. A lot of people bring food into the bedroom. They'll sit there and eat in bed. So
Right.
don't, yeah, takeaways, pizza, or let's sit in bed all day and watch telly and eat pizza
Oh
and
yeah.
chill, right?
Yeah.
No. So we don't bring work into bed. We don't bring food into bed. We don't bring any daytime activities into bed. We keep
Mm-hmm.
bed solely for sleep and sex. Now, if you don't have a problem with sleep and you can sleep like a baby and you can do all these things, that's not a problem. We're
Mm.
talking about changing people's behaviors when they've got chronic insomnia, when they're struggling with sleep. And
Mm-hmm.
again, napping. I mean, there's lots of discussions to be had around napping.
Yeah.
If you're really, really tired, a lot of people get into this little habit of napping during the day. But if you nap during the day, if you nap for too long, I mean, how many people here have had a nap and then you wake up feeling really
Today.
groggy? Yeah, and you're like, oh God, I feel like a zombie. Because and that's because you've napped for too long. So, I talk
Mm.
about the 90-minute sleep cycle. Well,
Yeah.
if you nap for the full, 90 minutes, an hour, and you wake up and you're in that stage 3 sleep, that really deep sleep, if you wake up when you're in the deep sleep, that's why you feel like a zombie when you wake up
Right.
and you've had a little nap. So they say if you're going to nap, just nap earlier on in the day and nap for like a short period of time for like 20 minutes. And then you're
Yeah.
not getting into that deep sleep cycle.
Mm.
Yeah.
That's helpful. By the way, guys, everybody who's on live, and we've got quite a few people on today, if you have any questions during the course of Becca and me talking, well, actually, mostly Becca talking because I don't even need to ask any questions.
Sorry, I just get on a
Do
roll.
put your questions into the chat.
Yes, please do
No,
ask
that's
me
all good. That's all
questions. I'll
good.
try my best to answer. And I'll keep going off on little tangents, don't I? And then thinking, oh shit, I'm not answering
Yeah,
your
well,
question.
it's super interesting. So I don't even need to do anything. I can just leave you alone and go to bed.
Oh,
Okay. So, yeah. So one more question about the like emotional trauma and stress. When is it too much? Is there any kind of anything from your clients that you've seen this is too much, or do you need a constant kind of stress going on? Where where do-
see,
where would
everyone's
it
different, aren't we?
as a yeah.
We're all individual, aren't we? And we all have
Mm.
different tolerance levels, I suppose. We all have
Yeah.
different breaking points, don't we? A lot of the clients that I see are midlife women, to be fair.
Mhm.
They're
Right.
midlife women. I mean, that's where I tend to attract these clients,
Mhm.
because women who have been through childbirth and never slept
Mhm.
since, right? They
Oh yeah.
brought up, yeah, they stopped sleeping properly when the babies, when the children were young and they're waking up in the night. And then,
Mm.
as a mum, you don't ever sleep properly again. You're listening out, aren't you, subconsciously for
Right.
anything going wrong. But then these women also, they've not only brought up children and run families, they've also run their own business. They also have
Mm.
high pressure jobs or responsible jobs. They've got husbands, they've got
Mm.
all the things going on in life, trying to balance everything. And
Yeah.
in the midst of all this, they forget themselves and they lose themselves, but they're carrying this massive weight. And then as you get older, I mean, I'm in my 50s and we get elderly parents, don't we? And then you've got
Mm.
stress that goes on with them and looking after them and watching them get ill and looking after them and looking
Hmm.
after the kids and husband, and this life gets in the way.
Yeah.
And I think these are the women in my experience that really do need, they're the ones that have been crying out for help. They're like,
Hmm.
I'm exhausted after years
Yeah.
of this. And it
I think
really
we're called
is.
the sandwich generation between grandparents getting ill and looking after children still
Yeah.
because it's been so late getting having
Yeah.
children, really.
So we
Yeah.
have a really nice combination because
Mm.
obviously I'm a hypnotherapist and a coach. A
Hmm.
lot of what I do is not just about the cognitive behavioral therapy for insomnia. That the CBTI thing is about, let's say, resetting patterns. It's
Hmm.
about looking at what exactly is going on. My clients do a sleep diary. We look at every week. It's quite rigorous, actually. I do sort of tell them it's like boot camp for sleep. It's a really hard, challenging program. It's not a walk in the park by any means, and it is
Hmm.
exhausting for them, because we look at psychoeducation, we look at, we do some sleep science, which is like what we've been talking about tonight.
Hmm.
We explain how sleep works. We look at a bit, do a baseline assessment. So we start off doing a insomnia severity index questionnaire. So we know what everybody's at to start. I ask them to complete a sleep diary every week so I can see what time they're going to bed, how long it takes them to get to sleep, how many wakings up in the night they have. When they wake up in the night, how long does it take them to go back to sleep? What time do they wake up in the morning? What time do they get out of bed? Any other factors? Have they had a drink of alcohol? Have they had
Hmm.
caffeine? Because how much exercise do they do in the day? Because all these things impact on your sleep.
Yeah.
So everyone's different. And when you're working with a client who is in that situation where they're struggling with their sleep, you have to look at it as a whole. And the advantage of being a hypnotherapist and therapist is that, you can help your clients reduce the anxiety. You can help them get rid of those things that are in that rucksack on their back.
Mm.
You can
Really.
help them lower their cortisol levels. You can give them breathwork techniques, emotional freedom techniques to do. You can give them strategies that can help them. You can sit down with them and help them, manage their exercise routine. You can look at diet. I look at exercise. I look at diet. I look at all this, as a holistic approach to sleep,
Mm.
because all these things do impact on your sleep. The foods that you eat impact on your sleep. The sugar content impacts on your sleep. Caffeine can
Yeah.
impact on your sleep. Some people are more sensitive to coffee or to caffeine than others. But
Mm.
alcohol's a stimulant. It's also a depressant, isn't it? But it's a stimulant. Even though if you have one drink, it can make you feel sleepy, and that's the thing that people think. Oh, I'll have a drink; it'll knock me out, make me go to
Right.
sleep. And maybe one drink will make you feel sleepy, and you'll fall asleep quick. But it fragments your sleep.
Right.
You've got the added thing of it affects your blood sugar, so you get the blood sugar spike, which can also
Hmm.
wake you up. It can leave you dehydrated, so you might wake up in the night wanting a drink, wanting to go to the toilet. It fragments your sleep, so you'll probably notice, people here, that if you've had a few drinks, you don't sleep as well. You
Mm.
sleep
Do
lighter.
do your clients have to stop drinking during your boot camp?
No, but
No?
I make them
Okay.
aware of
Mm.
what's your tolerance level. So I personally have learned that I can have 2 drinks,
Hmm.
and that is okay for me to still
Right.
sleep. So if I went out for a meal, I'd have a glass of wine, 2 glasses of wine, and that's fine. Any more
Hmm.
than that, and it impacts on my sleep. So I've
Right.
learned my tolerance level and what works for me, but
Hmm.
everyone else might be different. But I draw clients' attention. Nowhere do I tell people you can't drink or you can't do this. But if you want to fix your sleep, if you want to sleep better, then you need to develop this awareness, and you need to decide. Because right, the other thing is as well, people still need to live. So they're on my
Yeah.
program for 6 weeks. That's when we work together for 6 weeks. And we do this sleep diary because we look at sleep efficiency. So sleep
Mm.
efficiency, sorry, I've got something tickling my face. We've got sleep efficiency is how much time you are asleep out of how much time you spend in bed. And what we're aiming for is a score of 85%.
Right.
or above. When some of these ladies come and work with me, and they're not all ladies, but generally they are ladies. I work with gentlemen as well. But generally, we'll start off and they've got a sleep efficiency score of like 40%.
Wow.
So they're in bed for a long time, but they're not sleeping. So they might get in bed. And the other thing is, well, they might get in bed at like 8:30 thinking, I'll have an early night because I'm absolutely exhausted. But then they're lying there for like 2 or 3 hours, tossing and turning, trying to get to sleep. So that's not efficient. When you get in bed, really, you want to be falling asleep straight away, having a really good quality sleep, because it's quality over quantity when it comes to sleep. Sleep quality is excellent. That's what we're aiming for. We're aiming for the 85% and above sleep quality. Having 6 hours good quality sleep is better than having 8 hours not good quality sleep.
Yeah.
Right. So it's not really about how much time you spend in bed. It's about how good that sleep is. So you get in those full sleep cycles for all the biological processes and things that I was talking about earlier to take place, so that you're going to wake up feeling refreshed and like you've got energy.
What's the bandwidth of sleep? Is it like 5 hours to 9 hours, or about for people 6 to
Well, you wouldn't really
9?
want to be having on a regular basis less than 5 hours.
Mm-hmm.
On a regular basis over a long period of time, 5 hours is not healthy. There's links to cardiovascular disease, heart attacks, stroke, diabetes, dementia. There's links to poor mental health, poor cardiovascular health for people who have, poor sleep over a long period of time.
Okay, so that's again added stress and
High
what
levels of
else?
cortisol
Yeah.
generally, but also, is it true that an hour before? I don't know.
Okay, so the question was for everybody who's watching the replay. Is it true that an hour before midnight is worth 2 hours? Ish. Okay, ish. No?
No,
Okay.
because you can't go through those sleep stages any quicker. It's a biological process.
Right. Oh, I've heard that actually, that if you go to bed, you should go to bed before 10 because that's the most important time of sleep.
No.
No, okay.
When we're all different. We all have different chronotypes. So
Right.
some of us are early morning people. Some of us are larks. Some of us are night owls. Some of us are in the middle.
Right.
And so if you're and that's why sometimes it's difficult if you're forced to go to bed that doesn't fit your chronotype, you're not going to get an efficient sleep because you're going to be lying there and you're not ready for bed. You cannot force yourself to sleep.
Yeah.
You need to go to sleep when your eyes are dropping and you can't keep them open. That's when you need to go to bed.
I have clients who say they don't go to bed when they're tired. They go to bed when they absolutely can't keep their eyes open, exactly like you say. Because as you know, I work mainly with tinnitus, so they'll just want to knock themselves out before they go to sleep so they can actually fall asleep and not hear the sound anymore in their ears.
Yeah.
Is that a good approach then?
I think so, yeah. When you're
Yeah.
absolutely exhausted and you can't keep your eyes open anymore, because as soon as your head hits the pillow, you want to be out, you want to be going to sleep. I'll just show you, right? So I use this, okay, a sleep mask, right? It's a sleep mask. Now, I woke up this morning at 4 o'clock with hip pain. Actually, I've got a problem with flexor tendons at the minute, and for some reason, it's because I spend a lot of time sat down doing stuff like this. And so my hip was really painful. I woke up and I thought, right, I'll just go to the toilet as well while I'm up and have a drink like you do. But the light in the room, because it's summer, it's now starting. I'm in the UK, it's now starting to get light really early, and the light was stopping me getting back to sleep. I lay there with my eyes shut. So what I do is I have one of these now by my bed. And if I put that on, if I wake up in the night, put the sleep mask on, and it's got a little bit of pressure against your eyes as well. It's got elastic at the back. But I pop that on and I find it helps me to drift back off to sleep really quickly, more so than without it, because it's like it's cutting out all the light. Helps you get back to sleep.
So the light that hits our eyes is much more important. Does light that hits the skin, is that any important? Or does
No, it is
only
right.
eyes?
So with insomnia as well, another really key thing to get your clients to help them sleep better is to get them up in the morning and out and sunlight in their eyes as soon as possible. I don't mean staring at sun. I don't mean that. I mean just daylight. You know, so
Yeah.
I don't encourage anyone to go staring at the sun. That's dangerous. But
Yeah.
what's a really good thing for resetting your circadian rhythm, because our
Hmm.
circadian rhythm, right, is governed by light and
Hmm.
temperature and
Hmm.
cultural routine like food,
Right.
environment. Okay.
Hmm.
So light's the main thing, sunlight. So our bodies are governed by sunrise and sunset, and it's all to do with the change in blue light. Okay.
Hmm. Okay.
So that's how our body clock works. All of our cells have a circadian rhythm. Our circadian rhythm is governed by our suprachiasmatic nucleus, which is just sort of in the center of your brain, and in
Hmm.
the hypothalamus, or just below the hypothalamus. And the light that comes in goes obviously through your optical
Hmm.
nerves,
Nerve.
through
Yeah.
your retina, your optical nerves, goes to your brain, tells your brain that it's morning. And then
Right.
the decrease in that light at night, when the sun's going down and the light frequency, the wavelength changes, again, that signals to your brain that it's time to start
Hmm.
slowing down. And when that light changes, that's when melatonin's released. So
Hmm.
melatonin is released by the pineal gland.
Hmm.
And melatonin is our sleep signaling hormone. So a lot of people think that melatonin is a sleeping tablet. I've seen it so many times on sleep help groups and
Hmm.
Facebook things, melatonin doesn't work. And it's not a sleeping tablet.
Yeah.
Melatonin is a super hormone. It's released by your body
Hmm.
when the light changes. It signals to your pineal gland to release melatonin. Melatonin is the signaling hormone that tells your body to start preparing, slowing down, and getting ready for sleep. And
Hmm.
then before we wake up, when I said about the cortisol spike earlier
Hmm.
on in the early hours of the morning, again, getting towards the early hours of the morning when we're starting to wake up, your melatonin production ceases. So you don't have melatonin produced during the day when it's daylight hours. It's like, only the thing that comes out like vampires at night.
Right. What role does light pollution play, like lamps or, street lights outside the window, etc.?
Well, that can mess up your circadian rhythm.
Right.
And because if you work in, and that's why factory workers and shift workers, their circadian rhythms can go off
Hmm.
balance when we've traveled across continents. I think
Hmm.
the Industrial Revolution and the introduction of electricity did have a lot to play. But you see, before light and before electricity, where we could extend our days, we were
Hmm.
governed by natural daylight, weren't we? And
Yeah.
I'm not saying there weren't people with sleep problems then, but we were all more in sync with nature, weren't we, in natural
Mm.
daylight routine. Whereas now
Yeah.
we have people who work throughout the night because we've got electricity and lights that allow us to do that. And that often plays havoc with people's sleep patterns.
Right. So we've got most of the external factors, I think, covered.
Mhm.
What specifically about hypnotherapy and NLP can we do, or can we do to help our clients? Do you have any tips for the mind explorations community?
Well, definitely use your skills as therapists. So you've all got lovely, okay, relaxation techniques are so important. So
Hmm.
if you've got a client who is struggling with sleep, a wind down routine at night is key.
Hmm.
Okay, consistency is key. So having
Hmm.
a routine of getting up at the same time every day, even if it's weekend, and going to bed at the same time as best you can. I know life gets in the way, but as
Hmm.
best you can, sticking to a consistent routine of getting up and going to bed at the same time. And also, it's about having that wind down routine. So you're giving your body the signals that it's time to go to sleep. So
Hmm.
simple things could be breath work techniques, slowing your, like a down regulation breath work, in for 4, hold for 7, out for 8. Yeah.
Hmm.
Something
Is
nice.
that during falling asleep or in preparation
Do
before
that
you go
in
to bed?
preparation. So about an hour before you're
Hmm.
going to go to bed, lots of really nice things like the breath work, tapping, more some kind of visualizations are really key, meditation type things, visualization. I mean, you must, you've all got wonderful techniques up your sleeve of all different things that you use to help your clients calm their mind, and you want to give them these tools that they can do themselves every
Mm-hmm.
evening. So they have this little wind down routine. Also, to sleep really well, you need to cool your body temperature by 1 degree. Okay.
Right.
So
Okay.
cooling your body temperature by 1 degree, you can do that by having a warm shower or a warm
Mm-hmm.
bath an hour before bed.
Mm-hmm.
Okay, because the blood comes to the surface of the skin and evaporates the temperature. So it sounds like what having a warm shower is going to cool your body temperature, but it does. It cools your core body temperature because it allows your blood vessels to dilate, to come. You get
Okay.
the redness on your skin and it evaporates. The temperature cools. The
Mm-hmm.
air cools the temperature of your skin.
Okay.
So cooling the temperature of your skin, wind down by dimming the lights also.
Mm-hmm.
So putting low lighting on, low level lighting, candles, getting rid of anything that's stimulating or emotionally stimulating. So no horror films or things that are going to make you cry.
Mm-hmm.
Calming things down, visualizations, meditations, breath work,
Mm-hmm.
emotional freedom technique, anything like that. Anything to
Right.
calm the nervous system right down.
Mm-hmm.
Because that's what you're wanting to do, isn't it? You want to slow your mind. Other things would be like putting the day to rest before you get into bed. So if a client has got 1,000,001 things on the mind, you've got loads of kids' things to sort out, then get them to maybe write lists. Get it
Mm-hmm.
all down on a piece of paper, then you're not carrying it in your head in bed.
Yeah.
Maybe have a piece of paper and a pen near in bed, next to the bed, so that if you do wake up in the night with things on your mind, you can just get them off your mind really quickly, empty your mind, and then go back to sleep. Journaling
Mm-hmm.
is really helpful. So again, it's a way of getting things off your chest, getting things
Yeah.
out of your head, so you're clearing your mind before you
Mm-hmm.
go to sleep. Now,
Okay.
a useful tip for clients who wake in the middle of the night, because we all do that, don't we? I'm sure everyone here has woken up at, some silly o'clock and then thinking they can't go back to sleep.
Mm-hmm.
It's about doing something, again, it's about not allowing your mind to go off on this tangent that it's so easy to do, isn't it? When you wake up in the middle of the night, you start thinking, oh God, I never did that, and I've got to do this tomorrow. And then it's, oh God, I've got the kids' stuff ready for school and I forgot to do this. And, it's like you start doing all these lists of things to do. So again, the piece of paper by the bed will help, but also counting backwards from 1,000 in sevens. So it's about focusing your attention. So I
Mm-hmm.
also like to listen to a sleep hypnosis recording. So
Okay.
again, I find that more helpful than trying to meditate on my own, because if I find that really hard.
So they
So
do work, sleep hypnosis
they can
recordings.
do for focusing your
Mm-hmm.
attention, yes. So
Right.
I tend to use something that I just did myself for me, but a guided
Mm-hmm.
visualization or a guided progressive muscle relaxation. I find that
Yeah.
really helpful. So it's a case of, closing your eyes, taking some nice deep breaths in, and then just imagine, all the muscles from the top of your head going all
Mm-hmm.
down through, like a body scan, all the way down to the tips of your toes, relaxing all your muscles. And it just focuses your attention on you internally rather than wandering off. So
Mm-hmm.
counting backwards from 1,000 in sevens, if you're more of a maths brain, you might like to do something like that. Again, you could take yourself off on your own visualization journey. So some people like to just wander through the trees, wander down a pathway down to a lake, and just imagine yourself.
I'll read that out in a
Yeah,
minute.
okay,
Yes.
doing something like that. Another one would be count. So another one that's a little bit like a game that maybe you've played, where you can go through the alphabet and you
Mm-hmm.
can think of a name of a country for every letter of the alphabet.
Mm-hmm. Like little
It's
mind
just
games like that.
little mind games, but nothing that's going to stimulate emotion, nothing that's going to excite you in a way. It's got
Mm.
to be sort of a bit mind-numbingly boring, to be honest.
Yeah.
And if
Well,
you really,
yeah.
sorry, because if you really can't sleep after 10, 15 minutes, then in cognitive behavioral therapy, what we tell our clients to do is get out of bed, go and do something really boring, do some ironing, clear out a drawer, do a
Yeah.
jigsaw, you could watch a box set, but again, you could watch television, but again, something that's not going to make you cry or
Hmm.
scare you or evoke any kind of, any kind of emotion. Get yourself out of bed. Go do something mind-numbingly boring. Could be a maze or a puzzle or just something that's not, say, emotionally stimulating.
Yeah.
Till your eyes are sleepy tired, so you can feel
Hmm.
your eyes dropping, then get back into bed. And
Right.
that's basically, what some of the techniques that we would use to retrain your brain that what you are doing in bed is just sleeping. We don't lie there in bed anymore for hours tossing and turning.
Yeah.
We're breaking that habit and we're establishing a new way of thinking, being, and doing.
Yeah, I just got reminded of counting sheep, but I guess that's not on anymore. And I remember when I used to not be able to sleep, I would count sheep jumping over the fence, and all of a sudden they're all coming at once and breaking through the fence. That didn't work very well. But do we not count sheep anymore?
No, we don't really, because there's been
No.
some research done, and do you know what? She's an Australian. I'm sure she's Australian. I can't remember the name of the lady
Right.
that did
Doesn't
some
matter.
research, but I have done a little TikTok on it somewhere, and I can't remember the name of the lady that did it. But there's research out there to say that really counting sheep isn't as effective. You're more likely to get back to sleep doing a nice visualization.
Right. Okay. Oh,
Mm,
that's good to know. There you
yeah.
go. See, counting sheep. We have a question. I remember
Okay.
I read probably in Uncommon Therapy by Erickson, a case where Erickson asked a client with insomnia to get up and polish the floor if he could not sleep. Can this be used to reduce the pressure to sleep by changing the person's relationship with wakefulness?
Absolutely. Same sort of thing. Do something mind-numbingly boring. Do the
Mhm.
ironing, clear a drawer out, rearrange some photographs. Don't be paying bills because you might be off asleep and not know what you're paying. But like do something, yeah, something mind-numbingly boring. You could actually do some food menus, you could do some cooking, I suppose, but it's just something that's, like I said, it's not emotional. It has to
Mm,
be boring.
just some stupid task like
Again.
polishing the floor. Yeah.
So polishing the floor is a really
Okay.
boring task, and I don't say I'd want to do that in the middle of the night. And if you can't get out of bed, like so, some people, I know some people's, living arrangements might not allow that to happen. But
Mhm.
if you can get out of bed and go and sit in a chair in your bedroom and read in a low
Mhm.
light, yeah, even if your circumstances don't allow you to, go in another room. For example, I know the professor that I train with and that I have supervision with, Professor Jason Ellis, he's from Northumbria University. And when they do this kind of thing with people who are in prison, for example, they can't go and walk around and go do something
Yeah.
boring. So, they have to just get out of the bed in their cell and sit in another chair. And they would maybe
Right.
read or they would write or they would, that's what they're limited, isn't it, to either reading or
Mm.
writing, but they do something else until they're ready, till they're sleeping, till their eyes are going, and then get back in bed. Or even if you can't get out of bed, you might just sit at the bottom of the bed. But it's about getting up and sitting up and
Doing something else than
getting
normal.
out of that laid down, that
Yeah.
supine position where you're still breaking that pattern, but you're doing
Hmm.
it within the limits of, what your environment allows you to do.
Hmm. So, talking about patterns, going back to what we as hypnotherapists and NLP practitioners can achieve, can we help a client stick to new patterns or change their patterns successfully with insomnia?
Yes, because it's repetition, it's
Hmm.
practice. Absolutely.
Okay. So, how would you do that with like
Because
within a session, or do
no,
you
over
still have
six
to?
weeks.
Hmm.
So my program, so I work with these. So you think about this as we're changing biological patterns,
Hmm.
and it takes longer than 6 weeks, between 3 to 6 months
Hmm.
of constant repetition. So what we do in the
Wow.
first week, yeah, it's quite, as I say, it is quite a challenge. So in the
Mm.
first week, it's all about baseline assessments and finding out where we are and what, how
Yeah.
the sleep efficiency we establish, we talk about the sleep diary, we do like this insomnia severity index. I also screen for sleep apnea as well, because that
Hmm.
especially is really, common in
Yeah.
especially menopausal women. So we do lots of different baseline assessments, and then every week the client for 6 weeks that we work together, especially, and afterwards, but the client fills in the sleep diary. So that's how we monitor habits, we monitor behaviors, we monitor progress.
Mm-hmm.
Every week we look at sleep efficiency, and then we look at well, one thing I've not mentioned in all this is something that I do but you wouldn't do is sleep restriction.
Mm-hmm.
So because I'm trained to do it, sleep restriction means that we basically strip back, and this is why it's so hard to get that efficiency of sleep. We strip back the amount of time that a client is in bed.
Right.
So we strip it back to 5 hours. You never go less than 5 hours, but we strip back to 5 hours. So, say for example, a client wants to get up at 7 o'clock in the morning, they would not be allowed to go to bed until 2 a.m.,
Wow.
right?
Okay.
Which is a
Yeah.
killer. And you
Mm-hmm.
think, but what it does is it builds something called sleep pressure. And I've not mentioned this
Yeah.
at all yet.
Right.
Sleep pressure, it builds up every day from the moment that we wake up. Our sleep pressure builds up and up and up and up and up until that, when you can't keep your eyes open any longer, that
Mm-hmm.
point at night where you're fighting your eyes and you're just like you're gonna go, that's because your sleep pressure is so high. And that is like a chemical called adenosine.
Mm-hmm.
Okay, so adenosine is released by the body in the brain, builds up and builds up and builds up and builds up and builds up until it's at capacity, and then that's when you fall asleep. Your
Right.
system crashes and then it resets the next day. And that's why if you nap during the day, you are releasing. It's like your
Taking that
sleep pressure
away. Yeah.
builds, you nap and then it drops, and then you need to build it all up again. So that's why
Mm-hmm.
if you nap during the day for too long, it affects what time you get to sleep at night, because you've got to
Right.
build that sleep pressure up. So when we are resetting someone's circadian rhythm, we are redeveloping, we are retraining the body, and we build, to build that sleep drive. So
Mm-hmm.
we're building the sleep drive up all day. And then when the person gets into bed at 2 a.m., they will literally fall asleep and have a really good quality sleep for 5 hours. And
Yeah.
because they're in bed at 2 and getting out at 7, they're getting a really good efficient sleep.
Mm-hmm.
So
Yeah.
we monitor that, so it's really hard. And then when the next week we look at sleep efficiency, if it's really good, then we give them time back. So then they'll be
Mm-hmm.
allowed to go to bed at 1:45. And if
Right.
everything's okay and it's still going well, then they'll be allowed to go to bed at 1:30. So we give them
But they
time back in 15 minutes. But it is, there's some contraindications to that. There's
mm-hmm.
obviously risks to that, which is why that I don't teach people how to do that, because it's not safe for people
So
who are
you
not
would
trained to
work
do it.
with their GP, with their doctor or sleep
So
specialist, whoever. Yeah.
with
Mm-hmm.
me, because I'm trained to do it, and I've got,
Yeah.
I'm supervised. I have supervision with Professor, and I'm a member of the British Sleep Society, and also with the British
Mm-hmm.
Sleep Charity as well. So I've always got, I can take advice if I need it. So I wouldn't do this kind of work
Mm.
with just anyone. So for example, you wouldn't do sleep restriction work with someone who, say for example, is an airline pilot.
Yeah.
Right?
Oh,
You don't need them. You need to
no.
keep people safe at all times, don't you? You don't want
Yeah.
to put people in a position where they're likely to go off and have an accident. So
Mm-hmm.
long distance lorry drivers, you wouldn't do this kind of work with them.
Yeah.
Anyone who was operating machinery, you wouldn't do this kind of work with them, because
No,
you want to keep
absolutely.
people safe.
Yeah,
Yeah.
absolutely. But you would be doing this every day
So
for a few
every
weeks
day
until they've,
for a few
yeah,
weeks over the 6 week period, by which time they've established a really consistent pattern. They've hopefully built up to maybe 6 hours sleep, six and a half
yeah,
hours. And if they're getting regularly 6 hours sleep and they're feeling so different, then that's brilliant. It's like happy
yeah,
days. We're winning.
yeah.
Then they stop working with me. They check in with me every week, but they go it alone. They don't see me for a session sort of every week, and they
Mm.
don't have, they've learned by this time. I've taught them all the tools, they've got all the skills that they need, and they can carry on. They've got my support, but they just carry on for the next 3 to 6 months. And
So you release them back into the
I
wild.
release them back into the wild for the next 3 to 6 months. I'm there checking in with them.
Yeah,
Everything okay? Do you need me? And if they do have something go on later on in life, because once you've had insomnia, you're very likely to get it again,
oh,
especially if you're a woman. If you're a woman, you're more likely to get insomnia than a man.
hmm,
Biology. Some people are just more
right.
susceptible, but definitely if you're a woman, you're more likely to get it. And if you have had it before, you're more likely to get it, a different
Right.
episode, but you're more likely to get it again. But if you get it again, then you've got the tools, you know what to do to deal with it.
Yeah.
Yeah.
Okay. I have some more questions for
Oh,
you.
good.
So, Hillary came on late, I think. So we'll ask a question. Um, so no napping in the day, or is it okay to early nap before midday? We've
Not before
answered that before,
midday.
but just
I'd say definitely between 12 and 3, or, you know, earlier on in the day, if you can, if you really need to nap, have a little nap earlier on in the day. And, you know, don't nap for more than half an hour. Keep it less than
right.
that. Simply because of what I said about it, it impacts on your sleep drive.
Mm-hmm.
And, you know, so if you're napping during the day, it likely will affect your sleep at night. However, you know, if you need to nap to keep yourself safe, I always say to my clients, look, I don't want you to drive tired,
Yeah.
right?
Yeah.
Because we don't want any accidents. We don't want to put anyone at risk. So
Mm.
if you're absolutely on your knees exhausted and you've got to go and pick the kids up later on, or you've got to drive somewhere, then of course have a nap. You've got to keep yourself safe. Safety
Yeah.
is, you know, is paramount. There's
Mm.
more accidents, you know, like this is the really important thing about why we need to look after our sleep, because if you're driving tired, you're more likely to have an accident. If you're more likely to have a workplace accident. And it's like if you haven't had sleep for 17 hours and you drive, it's like driving drunk.
Yeah. Yeah. Do you know how many glasses of beer or wine that would be? How many
It's the
units of
same, it's the
alcohol?
alcohol limit. So if
Oh,
you
right.
haven't had sleep for, I can't just remember what the statistic is, it's the same, your blood, it's the same as your blood alcohol limit as the drink driving laws in the
Right.
UK.
Crazy.
Yeah,
One.
you haven't
Wow.
slept for 7. That's the same effect, your reaction times, the cognition,
Mm.
it's the same as if you were on the drink drive limit. And so that's
Yeah.
why people have, you know, accidents when you're driving tired.
Mm-hmm.
Everything slows
Yeah.
down, your reaction slows down, your thinking's different.
Definitely.
Yeah.
Yeah. Another question. What would you do if chronic pain was the cause of the insomnia?
Okay, so I deal with these catch-22, isn't it? Because when you're in pain, when you don't sleep, it's like you feel pain more. It's like it's like
Hmm. Oh,
you deal with first, because
yeah.
pain stops you sleeping. And then when you don't sleep, you're more sensitive to pain.
Yeah.
But
This
then when you
vicious cycle.
sleep, you
Yeah.
heal. So
Hmm.
it is a difficult one. I would be more likely to focus on managing the pain, because then you get a best. This is me personally. I would likely want to manage pain first,
Hmm.
and then hopefully you will sleep better. When we don't sleep, we're more focused on pain, because during
Yeah.
the day you've got lots of distractions. There's lots of other things that your brain focuses on, even if we don't intentionally do it. We're taking in all the stimuli from the day, aren't we? Things, sights, sounds, smells, everything, that your senses are totally absorbing everything. When you're
Hmm.
led there at night in bed and it's dark and you haven't got
Mm.
that, your brain more focuses on your pain.
Yeah. Yeah. And we've got Karen on who has chronic pain and neighbor noise all night.
Oh gosh.
How would you work with that? I mean, you can't
Earplugs.
switch off the neighbors'
Ear-
earplugs, yeah.
Earplugs. I haven't got any to show you, but earplugs are really, you know, they're going to
Great
be really useful.
earplugs. I
Especially,
have
oh, of
fun.
course, tinnitus lady, loads of earplugs.
Yes, my yes, earplugs.
Earplugs.
Always good. Yeah,
Yeah,
these were the best ones I tested. So open
definitely
up. There you go.
earplugs.
These ones. Can you see them? Like this. And you squeeze them small and you press them into your ears and then they
Yeah.
expand again after a while and it's going
So,
to take
yeah.
a little bit.
So I'd be
And
having
then they
earplugs and eye masks. I've also
there you
brought
go.
these to show you. So
Any rubber won't be heard.
these are, oh gosh, look at me. These are, and I don't know if they're not particularly great quality, but I got them to test. These are blue light glasses. So again,
Ah,
you know, we're talking about calming the mind down at night, reducing the stimulus to the senses, dimming your lights,
mm,
and calming the environment down. Well, I bought these to try them, and they've got a tint on the lens,
Right.
and they're supposed to filter out the blue light.
Oh,
Whether they
are they
work or
special?
not,
Like special from the opticians, or are they
no,
just
I know
like,
I got these online actually, but I suppose you could
oh,
get, I mean, you could pay a fortune for them. But there's research, you see, it's like anything, isn't it? You can find research to support the use of blue light glasses, and then you can find other research that says
yeah.
they don't do anything. It's like, scrolling and screen time, because they say blue light emits from mobile phones, so you shouldn't be
Hmm.
scrolling. But then there's other research to say, well, it doesn't really impact that much. It's not about the blue light, it's about the content and the
Yeah.
interaction that stops you
Yeah.
sleeping. So,
Right.
you know what I'm
Yeah.
saying about emotional content, things that get you angry, things that get you sad, things that get you, involved are more likely to stop you sleeping than the blue light that's being emitted from your phone.
Right.
So
Okay.
there's, another thing
Mm.
that I tried, which I don't like, is this thing.
Oh, a calm, isn't it? No,
It's a
what's it called?
handheld sleep
Yeah.
thing device, and
Isn't that for ADHD, really?
I don't know, it's supposed to work on an acupressure point,
Yeah.
and
Okay. Right.
and it emits a little electrical impulse. So
Mm-hmm.
it isn't charged up, but you basically switched it on. Glass, I don't know if glass does actually filter out.
Glass natural filters blue wavelengths. Derek knows, I'm
Does
sure.
it? Okay. All right.
Derek's
So
commenting that
yeah.
glass naturally filters blue wavelengths.
Torture. Yeah,
Uh,
this bit. Oh God. Yeah, Hillary. You're not wrong. Torture. I hate this. I tried it because somebody on a sleep forum that, I follow quite a few of these things, looking for what people try, because I'm thinking, to give advice. I'm trying to think, well, what do other people in the sleep insomnia world, all these
mm,
people suffering and reckoning on they've tried everything. What have you actually tried? Um, so I bought this again, and it emits. You switch it on, and it emits this like electrical impulse. It's like having an
right.
electric shock. Now, for some
Oh,
people, they might find that very therapeutic and soothing. You just hold it in your hand while you go to sleep. Oh God, I found it like torture. I couldn't do it. It doesn't work for me.
oh, well, yeah, that's why it works for ADHD because you stay focused.
Yeah.
I, that's a friend of mine
Maybe,
got them.
yeah. Another
Yeah.
thing that I've tried, which I love now, this is a tropic. I don't know if you can see it on it, but this is a
Yeah.
sleep spray.
Ah.
So this is a pillow spray. And again, this on its own is not going to cure insomnia, but it's
Mhm.
all about doing things and finding things that help you to calm your mind and just slow everything down and make bedtime a nice ritual. So I say having the candles lit and
Yeah.
having this has got lavender and frankincense in it, and he's got quite a lot. I think it's got quite a lot of lovely things. Lavender, chamomile, and frankincense essential oils. And I spray this
Right.
on my pillow, and it's just that nice. Again, it's like conditioning your
Hmm.
brain
Yeah. Anchoring yourself. Yeah.
to sleep. So it's like
Mm.
part of my little routine. But when I smell that now, because I know that it's bedtime, it's all this conditioning, isn't it? That
Yeah.
a little spray
Hmm.
helps you to sleep. So that's worth trying, something like that. You can get sleepy teas, like
Mm.
chamomile tea or sleep blends now. You can get lots of sleep blends for tea. Adele,
Adele's doing it all. She's made a nighttime tea. She's got that
yeah,
sleep spray, and she's not a rat
milky
because even though it smells nice.
milky drinks, like a nice little milky drink, because in milk there is something called tryptophan, which is a precursor for melatonin.
Right.
So milky drinks, like you can just put a bit of Ovaltine in there, malted milky drink, something like that can help you sleep. Um, Now I'm not suggesting one moment that people take supplements, but sometimes I've found that like magnesium glycinate. Now again, if you are going to take a supplement, I will say this, you do need to check with your GP that it's safe for you to do so. Um,
Hmm.
but magnesium glycinate, again, it's not a sleeping tablet, but it helps to calm your mind. It helps to reduce any
Right.
anxieties. It's a mind calming supplement, a bit
Mhm.
like ashwagandha, some of these other supplements that can help to calm your mind. But again, you need to research them. You need to make sure that they're safe for you to try, that they're not going to interact with any other medications that you're taking. Um,
And medical disclaimer, do ask your doctor before
yes,
trying any
medical
of these
disclaimer. Do
because
this.
this
Yeah.
is not medical advice.
No, it's not. It's not. This is
It's
just
not.
my personal things, that I've found that work for me. But again, yeah, definitely check with your own medical practitioner if you're going to try anything of those supplements. But these are the things
Yeah.
that come up all the time, in forums where
Mm.
you're looking at what people have tried, and they're all trying all sorts. mushrooms and tinctures and, and I think a lot
Everything. Oh, have they tried? Sorry, Guy, just
of
put this out. Have they tried grounding sheets? You know, those silver sheets that
oh,
are connected to the ground. Do they work?
I believe so. I know a sleep
Yeah.
therapist who swears by them. I haven't used
Okay.
one myself. That's something that I would like to do in the future.
Hmm.
But again, it's finding something that works for you, isn't it? I mean, there's all these
Yeah.
different things that people try, and what works for one isn't going to work for another because we're all very
And how much
different. We all like different things, don't we?
and how much placebo is in there? That's the other
Exactly.
question.
Yeah. Yeah. Good point.
But so, okay, so just to kind of summarize, because again, I'm going back to we're hypnotherapists and NLP practitioners. We do not sell any sleeping sprays, but but so we could use the sleeping spray or anything else, the smell of the pillow or the lying down,
Yeah.
as for example, anchors to help people get to sleep better.
Yeah.
So we would need
Calming
to use good
music.
anchor.
Mhm.
Calming music. We could give them an audio to listen to,
You could
maybe.
indeed give them
Yeah.
audio to listen to.
What else could we do?
Meditation
Help
app.
them. Yeah,
Maybe,
help them
yeah,
establish their routines faster so they actually stick to them, so they don't watch TV until late in the night, but
you can help them
start there.
reframe their thinking about sleep. So a lot
Hmm.
of people get, hung up on the fact that if they don't get 8 hours, then they know they're going to be absolutely
Oh, yeah.
exhausting tomorrow because they haven't got their 8 hours sleep. But people actually don't often need as much sleep as they think they do. So
Yeah.
sometimes it's about reducing the anxiety around the thoughts about sleep.
Mm.
It's about changing the way you think. It's about reframing the thinking. So that's where a lot of the, your NLP stuff can come in, maybe, or
Hmm.
the hypnotherapy techniques can come in, reframing people's thinkings about sleep so that you take away the anxiousness. And
Hmm.
just one word on sleep smartwatches and things like that.
Yeah.
Those can often fuel anxiety because people
Right.
get obsessed with looking at how much REM sleep they've had and how much which stage and that stage sleep they've had, and that in itself fuels anxiety. So
Mm.
you're all brilliant therapists and you've all got wonderful ways of reducing anxiety, helping people to change the way they think about sleep. The less sleep is paradoxical. Like any other skill that we have, the more we practice, the better we get. The more
Mm.
attention you give sleep, the further away it goes. So really, you've
Right.
got to get into this mindset of giving sleep the least attention that you can give it and just allowing it to happen. And it will
Hmm.
happen because you cannot function without sleep. You will survive longer on this planet without food than you will without sleep. You
Whew.
you will. So yeah. So you've got to sort of take away the anxiety around sleep, reduce the
Hmm.
negative thinking around sleep, allow sleep just to happen, not to force it, and to just just get people into a nice consistent routine.
Yeah. Yeah. And as Derek says, I would like to sleep is better than I must sleep because you
Yeah,
would be forcing
absolutely.
yourself. And that's again putting cortisol into your system, I suppose. So, okay, let's say we are at the end of our rope with our client who has still not made any progress with our little techniques and everything.
Mhm.
Where do we reach you, Becca? So that we can
Oh,
refer a client to you, for
I thought you were going
example.
to say, what do we do? I'm like, oh, refer to a sleep.
Oh, well, okay, what do we do? First of all, we refer to you, I suppose.
I thought that was another question coming for me then, because I'm thinking, do you know what? Sometimes you think, oh God, what am I doing? It's like you do get some really challenging clients sometimes, and you think, what if it's not working? Well,
Mm,
then I would, if it's really not working and I can't get it to work, then I would refer on to it. Maybe these people have got something more medical going on. They need
right.
one of those encephalograms, they need a proper sleep study, they need to go and see a sleep science
Hmm.
specialist, which their GP would refer them to. So, like I say, hypnotherapy is not going to cure everything. CBTI
Hmm.
sometimes can't cure everything. Although
Right.
CBTI is the gold standard around the world for curing or helping to improve insomnia.
Hmm.
So I will say that, and the research shows that there's lots of research out there now to prove to suggest that, should I say. Yeah, so for me, if anybody would like to work with me or would like to talk to me about sleep, need some advice with their clients, you're more than welcome to reach out. But you can find me on my website, which is drbecca.co.uk. So that's www.drbecca.co.uk. And if anyone would like to join my sleep course, I have a sleep, I'm doing a sleep for therapist course at the
I
end.
had it somewhere. I know I still have it somewhere.
Oh,
No,
thanks.
I don't. I had it, but I don't have it anymore. Okay, yes.
Okay, so on the
Tell
28th
us.
of June 2026, so that's the end of this month, I'm doing a one-day course for therapists from 10 o'clock till 4. It's on Zoom, UK time, and basically what we're going to do is do some more, do some sleep science. So we've touched base, we have touched on that tonight. So we'll do some more sleep science. We talk about sleep. We talk about insomnia. We talk about what you can do to help your clients sleep better. We do touch more on the cognitive behavioural stuff, give you more things like we've talked about today, really.
More
But
tools,
so
more
that
tools
you
and
can
information.
help,
Yeah.
more tools and information that you can help your clients to sleep better. So with this is for
Wonderful.
things, when normal, like I say, in normal cases where you've just got a simple problem with the sleep, then a sleep audio and some simple sleep hygiene advice is likely going to work. But this is for when that doesn't work, when it's not fixing the problem, what else can we do? And that's where the stuff that I do just goes into that little bit of a, deeper level.
Wonderful. I would love this to be the last words, but I have one more question. So
Yeah.
if somebody comes to you and you know immediately this is not a client for me, I won't be able to help them. What is it that they've said to you or that you've noticed about them that makes you send them straight to the GP sleep lab or whatever? When would you not take on a client?
Okay, so I wouldn't, excuse me, I've got an itchy nose. Something's really tickling me tonight. I wouldn't take on a client, like I said, like we've said before, with the general contraindications. So bipolar, schizophrenia, multiple personality, those kind of
Those
things that I
psychological
wouldn't,
things,
yeah,
yeah.
the psychological things. I wouldn't do CBTI with children. I don't work personally. I don't work with children, so I wouldn't
Yeah.
do pediatrics. Yeah, anyone who you wouldn't normally work with in a hypnotherapy context, then I would.
Okay. All right.
Same
Okay. So you're not
contraindications.
like, oh, I'd wake up and I can't breathe or, something like that.
Because I
When,
could do, well,
what are
yes,
the
so
warning signs,
with
the red
that,
flags?
that would likely be sleep apnea. So I can do
Yeah.
a sleep apnea screening,
Mm-hmm.
which is called a stop bang questionnaire. So I can screen for sleep apnea, but again, that needs medical attention because they would need
Yeah.
like CPAP, or they could need, an oral appliance that can move the position of the jaw so it opens up
Right.
the airway so they can sleep better. But again, they need specialist advice for
Yeah.
that. So
Okay.
yeah, there are contraindications. There are certain people that I wouldn't work with. But yeah, anyone who's really struggling to breathe, then definitely refer. If this, and it's not always really obvious either, and they
Yeah.
often don't know that they're not doing it, that they're not breathing. Often it's the partner,
Yeah.
because if you're
They
not
hear
breathing,
it.
you're stopping breathing, or you're snoring a lot, really heavily snoring. And often that is again with women that are going through menopause, when the collagen and the structure changes in the throat.
Or
It's not
dog.
always,
Yeah.
you think that. Yeah, definitely. That's another story, isn't it? Do you have pets sleeping on your bed? Does that
Yeah.
disrupt your sleep? But you often associate sleep apnea with overweight men. Yeah,
Yeah.
or even overweight women. But it's not that. Slim people can get sleep apnea too. And,
Right.
it is often misdiagnosed or undiagnosed in menopause, or women going through perimenopause and menopause, because of
Right.
the way that the collagen changes in the skin and the structures, the soft tissue structures at the back of the throat, so that when they're breathing at night, it is affected, and they can stop, there's this apnea, there's this lack of oxygen going to the brain. So it's often people who sleep next to these people that recognize it. So
Yeah.
you can have a screening, but then you would need medical. Left untreated can cause big medical problems later on down the
Right.
line. It needs to be
Right.
treated. So something like that, you would need to go to a physician, a GP specialist.
All right. Right. Wonderful, Becca. Thank you so much for being here.
You're welcome.
And
Thank you. I've loved it.
and there's people
You.
saying, oh, that was Adele. Um, this has been an amazing talk. Thank you, Dr. Becca. I'm all ready for a great sleep tonight now.
Thank
So
you
am
so
I.
much. That's lovely.
And thank you everybody for joining. And I'll be putting all the links to Becca's website, Becca's course, etc.,
Thank you.
into the show notes, into the comments. I'll try to have the replay ready by tomorrow. If not, then Thursday. But yeah, thank you so much for being here, Becca, and
You're welcome. Thanks
lovely
for having me.
chatting to you.
Yeah,
Thanks so
thank
much for
you.
all
Loved it.
your
Thanks everyone for
knowledge.
listening. Thank you for coming.
You're welcome. Thank you too. Okay, bye bye everyone.
Thank
Have a
you.
good
Bye.
evening. Bye bye.